after you've had a C-section, so as you know, you have a scar. So from where they had to go in to bring your baby out, so they cut through a lot of layers when they do that. So one of the most important things once your scar is fully healed after a C-section is to massage it and to get it moving. So not just the scar, the skin above and below the scar, and to get even deeper and make sure that that scar is not getting adhered to your bladder or your uterus that live underneath that area. So what could happen and what we want to prevent down the road is any issues with the bladder from there being scar tissue or being scarred or adhered down to that. So we want to make sure that we get everything moving in this area. Another benefit too is that if we don't, then a lot of times our lower abs and pelvic floor kind of shut down because they're all in this area, so it's all affecting it. And so in order to make sure that we're reconnecting and able to strengthen our lower abdominals, which is very important, recovering from having a baby, that we want to make sure that we're working out this whole area so that we can feel our lower abs work, okay? Because when you cut through a muscle or cut through anything, the muscles in that area are going to shut off, and we need to reconnect to them. But one of the ways that we'll be able to better is if we get that scar moving. So I have not had a C-section again, but I'm going to show you just some different techniques. So I'm going to talk you through them. So over the scar, you want to wait to do anything on the scar until it's fully healed. Typically around 6 weeks it should be. At your checkup, your surgeon your OBGYN who performed your C-section may say that you're fully healed, and so that's a good indicator that you're ready to do some scar massage. So you can start on the skin around, so above or below or to the sides of your incision before the scar is fully healed, and you can use these same techniques on that area, but just wait till it's fully healed to go over the scar. So the first one, you typically just use a couple pads of your fingers, 2 or 3 fingers, and you're just going along the scar in all different directions. So you can go up and down along the scar like this with my fingers, just applying as much pressure as you can tolerate. Then you could go side to side. Then you could do circles one way, and circles the other way. You could do a diagonal so that you're kind of stretching the tissue. You can hold, so you could kind of push down, apply some pressure, and hold and stretch all along that tissue as well. You can apply as much pressure as you're able to tolerate. It might be a little sore to begin with, so I would start light, and then as you can tolerate more, go a little harder. There's also a technique called skin rolling. There's a couple different ways to do it. One way is to pick up the skin and just simply roll your fingers across it. So I'll do it over here so you can maybe see a little bit better in this video, but you'll kind of pinch the skin and then just roll it along like that, so like a rolling pin. So you can do that over the scar or on the skin around the scar as well, and that kind of just gets things moving. That's the whole goal here, is to get everything moving. You can also do a different variation of that where you're just pinching the skin up, and then you're moving up and down, side to side, circles, circles. So you're just kind of going through all these different motions, and then again, go all the way along the scar when you do that. So honestly, any way you can move the scar, move the skin around is going to be good. We just want to get things moving so we don't get the scar to adhere to anything underneath it. So that way we get everything moving. That way you can reconnect to your lower abs and your pelvic floor.